Okay, welcome back. Today we're continuing our review of our first practice exam. If you'd like to find this practice exam and our other two, please check out bcbastudy.com. Questions, comments, let me know. As always, work hard, study hard. Let's get to our questions. 169. Which of the following is false about the changing criterion design? How should we approach this? Well, let's start thinking, what do we know about changing criterion designs? We're trying to increase or decrease a behavior. The behavior needs to be in the client's repertoire. We can establish functional relations by watching how the behavior reacts to our changes. Okay, pretty clear on what changing criterion designs are, right? Now, let's find what's false or what isn't true about a changing criterion design. A, we should alter the magnitude of the criterion change. Should we change or should we alter how much we're changing the required criterion? Yes, that's going to help establish some sort of functional relation, right? If we're steady, okay, it's going to be a lot harder to see if we're having control of the behavior. So A is false. B, the more criteria, or A is true, I should say. You should alter the magnitude. B, the more criterion changes you make, the more you can demonstrate experimental control. This is also true. Along the same lines of magnitude, if I make a change 100 times and the behavior follows 100 times, that's more telling than if I make one change and the behavior follows one change. A and B are both true. C, there is no baseline in changing criterion design. That's not necessarily true, right? If we want to know where to start our criterion, well, a baseline is going to be helpful. So C is going to be false. D, the length of each treatment phase should allow the behavior to appear steady. Yes, as always, we're looking for that steady state before changing conditions, or in this case, changing criterions. What is false? C, there's no baseline in changing criterion design. 170, using discrete trial training with your client. Typically, you will run several unknown targets and then mix in a previously mastered target. What are the mastered targets considered? What are we trying to do here? What are we trying to check for, right? If we're trying to mix in these mastered targets, we're not just doing it at random. We're trying to do it for a reason. If we're running previously mastered targets, what do we want to make sure the client can do? We want to make sure the client can still do the target. And if we've stopped teaching, and they can still do the target, what is that considered? Maintenance, right? So these are going to be maintenance targets. So A, incidental teaching, well, it tells us we're using discrete trial training, so we're not using A. They're not distracted trials because we're actually trying to pick or demonstrate these master targets. It's not mass trial. Mass trial is running the same thing over and over. It's going to be maintenance trials. Have we maintained our ability to do these master targets? Can we still do that skill? That's what we're checking for. 171, pick the term that best describes the particular type and sequence of conditions in a study so that a meaningful comparison of the effects of the presence and absence of independent variables can be made. Whew, a lot, right? A lot of words, a lot of confusing stuff. Let's break it down. We have a sequence of conditions in a study so that a meaningful comparison of the effects of the presence of the absence of independent variables can be made. So a sequence of conditions studying the effects of independent variables. What does that sound like to you? Think about our withdrawal designs. What are we doing with our withdrawal designs? Well, we're introducing IVs and seeing the effects. What about multiple baseline? Same thing. Implement an IV, let's look at the effects. We're comparing the effects and presence of absence of independent variables across conditions. Now, functional analysis, right? We're manipulating antecedents and consequences, okay, but we're not necessarily manipulating interventions, right? What about experimental design? Yes, experimental design, this is the definition, right? We're taking sequence of conditions in a study so we can compare the effects the presence and absence of independent variables. Again, just think about a withdrawal design. We have a non-presence of an IV. That's our baseline. We introduce it. We have a presence of the IV. Withdraw it again, the absence. We're going to compare those two. Functional behavior assessment can include indirect and direct assessments, but it's not comparing the presence and absence in a sequence of conditions. And narrative recording is just a type of direct recording, ABC recording. This is the definition for experimental design. 172, of the following, which behaviors will be considered functionally equivalent? What do we mean by functionally equivalent? Well, we mean behaviors that achieve the same thing. behavior happens to gain or get rid of something, right? So if we have a functionally equivalent behavior, both behaviors are either going to gain the same thing or get rid of the same thing. So cutting the grass and weeding the flower bed, are they doing the same thing? Well, no. One, you're cutting grass, and two, you're weeding the flower bed. They don't serve the same function. D, putting trash in a trash can and recyclables in a recycling bin. Again, this is discrimination. It's not the same function. Trash and recycling are not the same. Driving through a car wash and hosing down your truck. In both cases here, what are we doing? Well, we're applying water to our car or truck to clean it. C best serves the same function. We're achieving the same goal. Hosing down the truck, driving through the car wash achieves the same thing. Yelling to gain attention and hitting your mom to gain a snack. One, we're gaining attention. The other, we're gaining a tangible or a snack. Not the same. Driving through a car wash and hosing down your truck are the closest thing to being functionally equivalent. You're a behavior analyst. Your client tells you that they are taking a trip soon and will be flying on an airplane. They want you to prepare their child for the flight. Use various behavior analytic interventions, including social stories, to prepare the client. But when the client gets to the airport, they're too scared to fly. Your intervention lacks what dimension of ABA? Uh-oh. Our intervention was not successful. That's a problem. Our interventions need to be what? Well, they need to work, right? So what dimension do we lack? Are we lacking behavioral? Well, no. You are targeting some observable and measurable behaviors. All the behaviors that go on with flights, right? You can observe. How are they handling the flight? How are they handling the lines, etc.? You're fine there. Conceptually systematic. Well, you're adhering to behavior analytic interventions, so you're adhering to our concepts. You're being conceptually systematic. What about effective? Were we effective, right? Did we provide meaningful change? Well, no. After all our hard work, the client is too scared to fly. We weren't effective. Technological. Can we be sure or not sure we were technological? No, we have no idea, right? There's no indication if this can be replicated or not. So we can't definitively say if we are or not technological. That's where you have to be careful. We have to use what information is given to us. So just because we don't explicitly mention it being technological or not, doesn't mean it is or isn't. We don't have any information on technological, so we can't pick it. What we do know is we weren't effective. The client failed to get on the plane. They were too scared to fly. Our intervention was not effective. Therefore, we failed this dimension. 174, when you first moved in with your roommate, they would sneeze every time you opened the front door. A month later, after opening the front door in front of your roommate, they rarely sneeze. This is considered blank. So what are we doing? Well, we have this reflex, right? Sneezing every time we open the front door. After opening the front door over and over again, so presenting the stimulus over and over again, they rarely sneeze. What have we done? Be careful with C. Is this operant behavior or respondent? Well, it's respondent, right? Sneezing is a reflex, okay? It's maintained or it's elicited by this front door opening. And by repeated presentation without sneezing, what have we done? We've done respondent extinction. It's not habit reversal. We haven't identified a habit and systematically changed it, okay? And again, it's not operant, it's respondent. Habilitation is being able to meet the demands of your environment, which we haven't done here, okay? Again, this is respondent. It's habituation, right? The repeated presentation of this front door, okay, has lowered the sneezing. 175, you're using an ABAB design to measure a math intervention to teach addition. Your average baseline in A was 5 responses. During the intervention phase, the average rose to 10 responses. When you went back to baseline, the number of responses remained at 10. What might be occurring? Okay, one of the dangers, or one of the downfalls, or one of the disadvantages of an ABA design, a withdrawal design, sometimes you can't reverse what you've taught. Math, reading, skills, sometimes you can't reverse them. In this case, what happened? Well, your baseline was 5. Intervention, you went back to 10. Back to baseline, they remained at 10. A, math interventions can never be withdrawn. Just not true. You can withdraw math interventions. It's going to be effective. Maybe, maybe not, but you can. Irreversibility is taking place. Yes, this is irreversible. Your intervention was too effective. You taught them how to do math, And now what you can't reverse it. You can no longer reverse that skill. Irreversibility is taking place. Not reversibility, irreversibility. And then multiple treatment interference. Multiple treatment interference is typically associated with an alternating treatment design, where one treatment after another impacts the outcome of the future treatments. Okay. Not to be confused with sequence effects, which have to do with conditions. Multiple treatment is more associated with alternating treatment designs. Irreversibility is taking place. Joanne is approaching the top of the mountain. As she gets closer, she starts to tell herself, just keep climbing, just keep climbing. This is an example of what? Joanne is talking to herself, right? So this is going to be automatic. It is a verbal prompt to keep going, to engage in a behavior. So it's a type of self-management, right? Is it an interverbal? No, an interverbal needs a second party. It's socially mediated. Is it listener behavior? No, listener behavior is also socially mediated. Self-instruction or self-monitoring. Is Joanne systematically monitoring her progress? No, she is delivering self-instruction. Self-instruction is a verbal response prompt meant to encourage or evoke a response. That's what she's doing here. Self-instruction, just keep climbing, just keep climbing. We're close, right? Keep climbing, keep climbing, keep climbing. Self-instruction. 177, you're picky when it comes to the type of wine you drink. Of the two stores near your house, only store A sells the wine you like. Store B never has it in stock. When buying wine, store B functions as what? First off, what does store A function as? Well, you know you have wine that you like at store A. So you see store A, it's signaling wine is available. It's an SD. What does an SD do? Signals a consequence is available. When you see that wine store A, it's signaling to you wine is available. Store B never has it in stock. So when you see store B, it's telling you not available. So it's not a discriminative stimulus. It's not A. It's going to be a stimulus delta. Stimulus delta is just the opposite of our discriminative stimulus. And SD signals it's available. Stimulus delta signals it's not available. Store B is a stimulus delta for wine. Not a motivating operation because you already want the wine. It's not altering the value. And it's not a consequence. Okay, it's an antecedent to you buying the wine. A stimulus delta, opposite of an SD, signals a consequence, is not available. 178, which of the following answer choices adds to external validity by showing that the results of earlier findings can be obtained under different conditions? All right. What is external validity? External validity is generalization, right? We want to generalize our findings to the world. So if we want to show that the results of earlier findings can be attained under different conditions, essentially we are generalizing and trying to find external validity. And how do we do that? Do we do that through withdrawal designs? Well, not necessarily. Withdrawal designs are very contained, right? Contained in our little lab or a little experimental setting, okay? Internal validity, great for withdrawal designs. External validity, maybe not as effective. What about technological? Well, technological, okay, is going to be intervention can be repeated over and over again. Just because an intervention can be repeated over and over again doesn't mean it's going to be externally valid, right? The results might not be externally valid. We might not be able to find these findings under different conditions. So systematic replication or systematic reproduction. Well, you're going to look at systematic replication here, right? Systematically replicating our design under different conditions is going to add to external validity.